Hello, everyone. Welcome back to Dr. the Podcast. I'm your host, Jovanna. Today, I'd like to talk to you about some lessons from the evolution of healthcare. When we examine the last 2.5 centuries of medicine, one principle emerges repeatedly. Healthcare advances when scientific discovery, engineering, public policy, clinical research, and patient care converge around a common objective. That observation extends far beyond the United States. It belongs to every nation advancing medical science. In 1776, physicians practiced without anesthesia, antibiotics, germ theory, diagnostic imaging, blood typing, insulin, organ transplantation, or modern intensive care. The stethoscope hadn't even been invented yet. The first successful public demonstration of surgical anesthesia remained 70 years away. X-rays were still more than a century into the future. The concept of a randomized clinical trial did not even exist, yet medicine still advanced. Clinical research has evolved from isolated academic centers into global collaborative networks capable of enrolling participants across continents. More than 600 million wearable devices were shipped globally last year, creating one of the largest continuous streams of physiologic data ever assembled. Historically, healthcare is operating episodically. The future of healthcare will not be defined solely by new therapeutics. It will be defined by how we effectively integrate clinical care, biomedical research, engineering, artificial intelligence, digital health, and implementation science into a cohesive healthcare ecosystem. This episode of Dr. Doctor is brought to you by ClinMatch Go, your clinical trial connector, connecting participants, physicians, and pharmaceutical partners to local clinical research trials. Please head over to www.clinmatchgo to find out more information. Thank you and welcome back. I do want to talk a little bit more about the numbers, as I think they are important so that we understand how truly far we come. With 250 years in the making, as we said earlier, in 1776 there was no anesthesia. However, in 1796, the first successful smallpox vaccination occurred. In 1846, public demonstration of surgical anesthesia appeared. In 1860, germ theory reshapes medicine. In 1895, introduces the X-ray. 1928, penicillin is discovered. 1954, the first successful kidney transplant. And in 1978, the first IVF birth. 2003, the Human Genome Project is completed. Today, artificial intelligence, precision medicine, wearable technology, and decentralized clinical research. I just wanted to share a timeline through the year. Please do what you can as healthcare advocates, participants, to continue to be a part of the conversation. Today, we celebrate this week 250 years. What does this conversation look like in 50 years on the 300th anniversary? Be a part of the change. Excited to be a part of healthcare in an innovative way. We're doing a great job. Right now we have 6,100 hospitals. As we stated, nearly 1.1 million physicians. We are doing great things, continue to do them. Happy birthday to our country. Thankful for everyone participating in the advancement of medicine.